Hey guys, hope you are all having a fantastic morning. Today, we are going to discuss yet again how Wall Street is taking over healthcare. New results are out and they are not good at all. Wall Street is betting on healthcare and the health insurance industry as well as profitable opportunities to drive in money, but the effects that private equity is having on patient health are not positive. In fact, there is a direct correlation between worsened health and increased private equity investment and subsequent management. Today we are going to discuss what has changed in detail. I want to thank Shelby Livingston and the Affordable Healthcare Coalition of North Carolina for supplying me with the information I am going to share with you guys today. Before we start, let me quickly state that I am not a financial advisor, and that all content discussed in this channel is simply information gathered that I deem important for people to know, so that they can make informed decisions. All efforts are aimed to better understand the nature of the current market in anticipation of the greatest squeeze in financial history. Let's get started. There is a growing trend taking place in the healthcare industry, and it's one that is not being talked about enough. Billions of dollars of private equity are being invested into buying up hospitals, emergency rooms and healthcare practices at an alarming rate. The aim is to maximize profits as much as possible and then sell off the practices once they ruin them through greedy and pushy decisions which drive away talented staff and customers. Many times, they also sell the practices right before the negative impact of their decisions take place, when the price for their investment is still high. The way they are doing this is by employing doctors and staff to gut down services to the bare minimum, raise prices and force major cutbacks on equipment. One of the key and primordial ways that Wall Street places a lot of focus on is on maintain themselves out of the spotlight while doing this. They are silent operators working from the confines in the dark. Oftentimes, patients aren't even aware that their lifelong doctor's office has been bought. They just start feeling the impact when the quality of service worsens while being forced to pay higher costs and copays. Even working in the dark, private equity's growth and overreach into the healthcare sector is rapidly growing. In 2019 alone, private equity's healthcare acquisitions reached $79 billion. 2018 was the first time that the United States had more doctors who were employees than owners of their own practice. Ever since 2010, private equity investment firms have spent more than $580 billion to buy out healthcare practices around the nation. The problem in this lies in the fact that the best healthcare and the biggest returns in investment are at odds with each other. You cannot provide the best and highest quality service you can when you are also looking to make the absolute best bottom line. According to a study by JAMA into private equity in healthcare, they found that private equity firms expect greater than 20% annual returns, and that these financial incentives may conflict with the need for longer-term investments in practice stability, physician recruitment, quality and safety overall. Speaking in layman terms, how does one secure a 20% yearly return into the investments one makes? Easy. The most obvious answer is to look at your expenses and start cutting costs and raising prices wherever you can. The problem has gotten so bad that treatment from a private equity-owned freestanding emerging room can be 22 times more expensive than at a physician's office, according to some research by the Harvard Business Review. A strategy that is currently being used is to increase revenues at certain points when patients tend to be at their most vulnerable. That way they are less likely to look for alternatives and more likely to pay the increment prices. The problem has gotten so out of hand that, according to an NBC report, private equity's growing involvement in health has contributed to shortages of ventilators, masks and other equipment needed to help save the lives of millions of people, all because keeping such goods on hand costs too much money. This new profit drive focus has had a serious impact on the quality and safety that hospitals and clinics have been providing. An official that works as assistant professor of healthcare policy at Harvard Medical School stated that private equity's need to derive a large financial recount could change the way patients are diagnosed or treated if those decisions are influenced by the need to generate a financial return. There are worries that there may be growing incentives for doctors to use certain that have a higher price tag or to refer to providers or labs owned by the same private equity firm that owns them. This is done to further drive in higher profits and forcing patients to pay for it without having any choice in the matter at all. And guess what is the next thing private equity has been focused on investing? There is no other place to look but to insurances, because insurance premiums are on the rise as well. Private equity groups have been buying up multiple practices across the nation and then merging them into large conglomerates, which they then use as market powers to extra even more higher payments from insurers. These higher payments are passed on as higher premiums in the policies. Publicly traded health insurances have been performing extremely well over the past couple of years, and this is unlikely to change anytime soon. The health insurers' bottom lines are benefiting from increased enrollment in government programs. While adapting to new changes and some scrutiny from Congress, health insurance has been working diligently to tighten up and consolidate, buying out competition or forcing smaller companies out of business. They are working hard to give you less options so that you are forced to use them. As such, once they do this, they will be jacking up prices at much higher rates than they already have. This is actually a big problem that Washington has foreseen, and is engaging in active dialogue to try slow it down. Wall Street is becoming increasingly predatory on the healthcare system. They see it as an opportunity to control every aspect and force people to pay whatever they want since they aim to leave no competition. The truth is, I think medicine is very different. Yes, the business model of doing what is best for you should be applauded, but when it comes to a person's health, that's where I draw the line. Capitalism is not working well at all with the health insurance industry, because like I said, profits and better service are simply at odds with each other. You cannot provide the best state-of-the-art service to a patient when you are trying to drive in the most profits available. By giving them lesser service, you are ensuring lower costs on yourself and in many ways, ensuring that that patient will be forced to come see you more often over time since chances are they will need more care. I think the government needs to crack down on the health industry once and for all, but the problem also lies that these companies invest a ton of money into political campaigns, hence why you never even see politicians really trying to change things. Everything is always about maintaining the status quo, so we are now where we are, paying higher costs for lesser quality. I made a previous video touching on Wall Street and the healthcare industry, and how far they have gone to ensure that people get worse treatment in order to secure higher profits. This seems to be an incredibly well-documented problem, with many articles and even research papers having been published that discuss this growing problem. It seems that as much as Wall Street loves touting that they love capitalism because of its ability to bring competition which is better for everyone, they are actually working hard to prevent the natural course of capitalism to take place by blocking the much-needed progression and growth of smaller companies. As such, quality of service in the health industry is being negatively affected by the greed of a select few. The world we want is going to need much better quality folk if we are to ensure a bright future for us and next generations to come. I hope to have inspired some thoughts and knowledge into you on this matter. I want to thank again the Affordable Healthcare Coalition of North Carolina and Shelby Livingston for their amazing work, which has been instrumental to understanding what exactly is going on in the healthcare industry and what Wall Street is doing behind the scenes. Feedback is crucial here, so let me know your thoughts, or at the bare minimum if you can't do that, just hit the like so I know. If you want to support this channel, I have a Patreon link in the description as well as some one-time donation links for Cash App and PayPal. Thank you again for being a part of this channel. I will continue striving for better content. Hope you keep having a great day, and I hope to see you later today on the recap video. Until then, keep on buying the dip into the moon.